Good afternoon, everybody. Happy Thursday. Welcome to part 2 of POPLAR's EDIIA in Research series. Today is building research projects with an EDIIA lens. As many of you already know, EDIIA stands for Equity, Diversity, Inclusion, Indigeneity, and Accessibility, for advancement and quality improvement in primary healthcare to be done equitably. It's important that research and practice-based learning are grounded in EDIIA principles. More than important, really, it's essential. So the POPLAR Network, which is Ontario's primary care learning and research network, is committed to advancing equitable primary healthcare delivery and healthcare outcomes for everyone in Ontario. And so that means that they are committed to embedding EDIIA principles in their work. And they've launched this webinar series to support that vision by building capacity for EDIIA-oriented research in primary care. The Alliance for Healthier Communities is pleased to be hosting these webinars on POPLAR's behalf. And for those who are unfamiliar with us, the Alliance is a membership association for community-based primary healthcare organizations in Ontario. And all of the Alliance members belong to the EPIC Practice-Based Learning Network, which is one of 7 such networks across Ontario that together make up POPLAR. POPLAR, in turn, is a member of the Canadian Primary Care Sentinel and Surveillance Network, or CIPSEN, which includes primary care learning and research networks from across the country. Today's webinar is about the key questions we need to consider when we are building value-driven and participatory approaches into research design in order to create opportunities to include people who are frequently underrepresented in research. Dr. Vivian Ramsden from the Department of Academic Family Medicine at the University of Saskatchewan will share her experiences in developing community-led participatory research. First, we'll cover some housekeeping and then start things off in a good way by acknowledging the original stewards of the land we're using today. So, a few quick housekeeping notes. Most of you are familiar with Zoom already. Just a reminder that this webinar is being recorded, and we will be sharing a link to the recording along with the slide deck later this afternoon or tomorrow morning. So please watch your email for that. There will be a Q&A session at the end of the webinar, so please do submit your questions using the chat panel or the Q&A panel. Feel free to start typing those at any time. As soon as you think of them, we'll keep an eye on them and we'll ask them on your behalf towards the end, and we'll do our best to sort of group similar questions thematically. I believe we also have a functionality now where you can vote up other people's questions in the Q&A panel. So we can sort of keep an eye on which ones are really burning for a lot of people in the group. If you would prefer to ask your question out loud, please use the raise hand function and we'll unmute you and then call on you to speak. But please do remember to mute yourself afterwards so we can keep background noise to a minimum. So before we start the presentation, let's acknowledge our presence on Indigenous land. We recognize that the work of the Alliance for Healthier Communities, our members, and the POPLAR Network takes place across what is now called Ontario, on the traditional territories of Indigenous people. They have lived here since time immemorial and have deep connections to these lands. We further acknowledge that Ontario is covered by 46 treaties, agreements, and land purchases, as well as unceded territories. We are grateful for the opportunity to live, meet, and work on this territory. Ontario continues to be home to vibrant and diverse Indigenous communities who have distinct and specific histories, needs, and assets, as well as constitutionally protected and treaty rights. We honor this diversity and respect the knowledge, leadership, and governance frameworks within Indigenous communities. In recognition of this, we commit to building allyship relationships with First Nation, Inuit, and Métis peoples in order to advance our knowledge and appreciation of the many histories and voices within Ontario. We also commit to sharing and upholding our responsibilities to all who now live on these lands, to the land itself, and the resources that make our lives possible. My name is Catherine, and I am a settler here. I live and work in Toronto on the traditional territories of the Anishinaabe, Wendat, and Mississauga peoples. Thank you. And now I'll introduce today's speaker. Dr. Vivian Ramsden, a registered nurse, is professor and research director at the Department of Family Medicine at the University of Saskatchewan. She's a facilitator of a partnership with a nursing college in Chennai, India. She's chair of the College of Family Physicians of Canada's section of researchers, and she's the incoming president of the North American Primary Care Research Group, or NAPCRAG. As a participatory health researcher in primary care, she engages individuals and communities in addressing the issues that impact their health. Thus, in long-standing collaborations with Indigenous communities in Northern Saskatchewan and South India, and with women released from prison, the outcomes have transformed health. Dr. Ramsden is here to share her knowledge and describe these experiences and the learning that came from them. Vivian, the floor is yours.
Thanks very much, Catherine. I'm just going to provide a little context for where I come from. I'm coming to you today from Treaty 6 territory and the homeland of the Métis in Saskatchewan. My background is the roots are from Sweden and Denmark, and I'm a mother of two, a grandmother of two, a nurse as indicated, a participatory researcher, and most of the relationships that I'm going to be talking a little bit about today are from 6 to 26 years in the making. This is not a one-stop shop. This is about engaging people in ways that are meaningful to them. Next. Catherine? Thank you. The learning objectives for today are that by the end of this activity, you will be able to describe the elements of equity, diversity, inclusion, allyship, and accessibility. And that you will have an opportunity to reflect on how this could be used in your clinical practice or your current research project. Next. You're all familiar with these definitions, but I just wanted to raise them in a slightly different way. Indigenization to me is actually on. And for participatory researchers, everything is about with. So I took a little quote from the Office of the Treaty Commissioner in Saskatchewan, who indicated that we're all treaty people here. We all need to work together. So it's not on, but with. And I looked at the idea of accessibility from the perspective of, this is about ensuring that an individual can obtain the needed care from the practitioner of choice within a time frame appropriate to the urgency of the problem. And I raised that particular thing because if any of you are familiar with Willie Ermine, he talks about ethical space, and I'm going to talk about it in a minute again. Next. So I want to set a context. In 1978, the World Health Organization got together, and these are the specific ones that I wanted to highlight from the Alma Ata. And it's about essential healthcare based on practical sound advice and socially acceptable methods. Universally acceptable, but what you probably didn't look at was through their full participation at an affordable cost and geared towards self-reliance and self-determination. Next. So in 2018, the World Health Organization went back and had a look at that. And so they now have a declaration of Astana, which looks at prioritizing disease prevention and health promotion. And in my world, it's really about wellness promotion. It's broader than health. And so it's meeting all people's health needs across the life course. It's people-centered and gender-sensitive. Next. In 2018, the World Health Organization committed to empowering individuals and communities through their participation in the development and implementation of policies and plans that impact health and wellness. They went on to indicate that they will support people in acquiring the knowledge, skills, and resources needed to maintain their health or the health of their wellness of their loved ones, guided by professionals, healthcare providers. But it's somewhat limited. And so our healthcare providers, we need to think broader. In ethical space, we're also talking about traditional healers as part of that bigger picture. We want to protect and promote solidarity, ethics, and human rights, and increase community ownership. Next. So primary healthcare really focuses on strengths, opportunities for change, with maximum involvement of the community. So much of the work that I'm engaged in is very much community-led. I would meet with the community before engaging in a research project. We would talk about what's important to them, and then we would find a focus that we would all want to work on together. Next. For those of you who are healthcare providers, you know that in the past, our programs and strategies have been developed in response to what feels good rather than working with people. And my experience in research is that that actually continues, and we focus on the questions that we often want to ask with little engagement from the people who should benefit from this particular project. Next. People know what they need. We just have to listen. And when we listen, there are higher levels of motivation and better solutions because they're involved all the way. And you'll notice in the back of this particular slide, the ability to see passing the baton. We need to share. We need to do it together instead of separate and apart. Next. Peoples and communities are an expert, and it actually is built within true, authentic partnerships. And it's about healthcare providers, researchers, patients, communities all coming together. So for those of us who are healthcare providers, we often are engaged in more than one role. And so it's important for us to actually identify what those roles are and how we're actually moving from one role to the next. Next. Everybody talks about co-creation. It's a collaborative approach to research that equitably involves all partners in the process and recognizes unique strengths. The research topic should actually come from the community, as I mentioned earlier, because that in turn has an opportunity for transforming their location, their practice, and their way of addressing some of the health and wellness considerations that they are concerned about. Next. So what's community? I mean, it's a big thing. Everybody talks about it, but the bottom lines are each community is unique. We talk about scaling. We talk about spreading. And sometimes we can, but often, in fact, the communities in Saskatchewan, there are 70 First Nations communities. Each one of them are different. Many of them have similar languages, but not necessarily the same. So we need to be thinking about transferability, which is often a qualitative approach rather than scaling and spreading, as we frequently look at in research. Next. In looking at that, we need to talk about the community's culture, traditions, customs, and codes of practice. It's theirs. We need to work with it, with them, to build authentic, reciprocal, and trusting relationships, which takes time. And so when I've got a grad student that's starting initially in a project, and they say, oh, well, let's get going, I'm saying 12 to 18 months, you will actually build a relationship before you're engaged in the project. And the project goes really quickly, but without the relationship, it doesn't go at all. So I encourage us to be thinking about, how are we doing that? Are we doing it respectfully, or are we doing it wrong? Next. From one of my Indigenous colleagues, Holly Graham, she indicated that it's clear that history has shaped current research, but we can change that. There's a comment about not being able to hear me. I've got my speaking stuff in my computer at 100%. So if there's a problem, you need to let me know, because it's not something I'm used to doing, speaking
Thank
loud.
Thanks. Yeah, Viv, I've noticed that there's moments where your voice cuts out a little bit, which it wasn't doing during the practice session. So if you've got something that's maybe blocking the microphone a little bit, that might be what's happening.
Not that I can see, but
Yeah.
okay. Okay, well, let's just keep going. I'll just yell louder.
Sounds good. Thank you.
Okay, next. Thanks, Michelle. So looking at Willie Ermine's sort of thoughts and ideas around ethical space, it's about bringing Western and Indigenous spaces together, and we need to negotiate them, and we need to work at it together in terms of how we're going to document it. So we've actually been working on pulling together traditional medicines and working with Western medicines at Sturgeon Lake First Nation to help patients be and feel as though they're integrating their worldview into their healing process. So I guess I'm actually encouraging you to think about, how do we do that? What does that really look like? I was very fortunate to go to an Indigenous medicine camp to be part of that process. It's not about the content that was important to me. It was really about, how do I do this better, so that it doesn't really matter as long as we document how their blood pressure is actually reduced and how is it maintained. Next. So I'm just going to talk a little bit about methodology with regard to participatory work. Next. The overall approach is about integrating the principles or values into practice, and it's about authentic engagement, respect, and action research. Next. The fundamental principles are about co-creation and co-design and co-ownership and co-decision making. So everyone is involved from before the questions are written to actually the conclusion of the study. Next. Research that is co-created is designed to improve health and wellness, and it actually mitigates or minimizes the health disparities because we're working towards the same common goal. So go, next. And this partnership actually is really important for us to be thinking about, because the peoples in the communities actually own the work. And so how we're sharing that information. And so for me, it's about consent. And if they're willing to share it, then we need to actually have some form of acknowledging that in a way that's meaningful. So I just can't take their data. I have to actually work with them and in fact leave the data and take the copies so that we can actually do the analysis at the end of the day. Next. Again, I talked about this earlier, so I just want to remind you that it's the community who identifies the issues, and we actually engage in the processes. Next. The things that we started even in the SPORE PCRN is to actually co-create a set of values that will describe how the team will work together. And I say that to you because it is the most critical piece. When things go wrong and it becomes a bigger deal, but it's certainly a way of saying, that really doesn't fit with how we set our values. And so we have an opportunity to take it out and look at it again. When we identify engaged communities and individuals, those sustainable relationships begin to build. And I encourage you to think about over time, so that it's not just on in that research moment, but in fact, it actually improves the health and wellness of the community as they become experts on your research team. Next. We use the principles of consensus. And so we actually develop everything, the purpose, objectives, questions to be asked, the data collection methods to be used, and then the actual data collection. Next. Be clear on the roles. Each member has a job to do. and ensuring that in fact everybody got to choose the jobs that they wanted, and then we support and provide it, is really an important consideration as you move that forward. Ensure that you build into your grant structural supports for honorarium, food, childcare, bus tickets, taxis, and sometimes it's actually travel. The community that I'm working with in northern Saskatchewan actually is about an hour and a half from Saskatoon, and so it's important that they also can come to Saskatoon, and so we need to make that available to them. And relevant training is for everybody, and so the community members have TCPS core tutorial certificates, just as we as healthcare providers and researchers do. Next. There's a whole discussion around, I'm going to call it data sharing agreements. Many are written, but some are oral, depending on the tradition of the community that you're working with. But it's important that the principles of OCAP, which are ownership, control, access, and possession, facilitate the self-determination over all of the research. And so Norma Rabinstein, that you can actually see as one of the authors on this particular book chapter, actually is very much engaged in this process with us, so that we can actually work together to find ways that are meaningful to the community to make it work. Next. Often the community collects the data, and then they actually engage in, I'm calling it participatory analysis, so that we can actually do some interpretations that have meaning to the community. I don't live there. I don't know that works. So the identification of insights and the actions to be taken become part of the dissemination in ways that are meaningful to the community. Like we use radio, we actually have a board that's, when you come into the community, you can actually see what's happening with regard to health in the community. Those are the kinds of things that they think are important. It's not just publishable papers. Next. How do we do it? Well, that's always a bit of a challenge, and you always go, oh, really? We meet regularly. We meet often. We share a meal. We return the data to the community for celebration, and we co-present. So Catherine, Marissa, and Jennifer and I were talking earlier about NAPCRAG, which is actually upcoming in November. The community members from the community that I work with are actually coming to NAPCRAG to present their abstracts, which were accepted for poster presentations. As a result of those discussions, they will come up with the next priority for our next research question. Next. We often forget to build it into the grant. And I encourage you to think how you're going to do that. Because my experience is that working with the community actually changes not only the outcomes, but how we do the business. And it actually makes it something that's meaningful on both sides. Next. Frequently, we talk about those that are not frequently engaged, or the underrepresented, or the underserved communities. They're still individuals, patients, and communities with an identified issue that they want to address. We need to talk about it like that, rather than focusing on words of deficit. We recently wanted to publish an article that was going to a specific journal, and I'm not going to say that the actual content was so deficit driven that the community removed their data. We are in the process now of developing that same data into a strength-based approach, so that the community can see, well, it might be 30% that they've done well, but they have 70% to go, but they can see it from that side, and they can actually build it in a new way. Next. Next. I have been engaged in this work for a number of years. And the language has changed over time. It used to be community-based participatory research. We now talk about community-led participatory research. The whole focus, though, is on co-design, co-production, co-leadership, and mutual learning within a systems model. If you think it's only the community that is learning, you're mistaken. When I was engaged in a prison project in British Columbia, it was the individuals with incarceration experience, the guards, and the researchers and healthcare providers that were in that institution that actually gained from the experience. So we need to actually, again, focus on the with. The principles espoused are found within the constructs of participatory research. It takes time, but it actually is an amazing outcome that you can't build any other way. Next. So as part of community engagements, the experiences and knowledge are important, but the relationships are absolutely key. And that's the stuff that I think one of Doka is on this call today, and he's actually being engaged in developing those relationships in a project that he's working on. And I look at it and go, the 2 years that it took to make it happen has been an amazing journey for him as I've watched him grow and become much more engaged at the community level and understanding of the mutual learning that goes on. Next. So education isn't just for community members, it's for faculty, clinicians, students, community members, and researchers, because each of us has something to contribute. And all of us are experts in the positions that we hold. And so I encourage you to think about what is your piece of the pie and how can you improve your description of that for the bigger team. Next. In about, I don't know, 2016, we had been engaging in a variety of issues, but we looked back at one of the projects that we had engaged in 4 different communities. And those communities were to identify the most commonly identified risk factors. And one of them that they were not anticipating, everybody thought, oh, diabetes. I mean, there's a lot of Indigenous communities in this process. So diabetes would be much greater, but they found that in fact, misuse or non-traditional use of tobacco was the most commonly identified risk factor. They didn't want to have a program that said stop smoking. They wanted the program to celebrate some element of taking a step forward. And so we looked at programs around the country, and there were a number, but we decided that we would focus on taking that step by taking their cigarettes outside. Several of the communities had had children that had been overdosed by chewing on the tobacco butts that are left on the table. By actually smoking outside, that actually mitigated that completely. We no longer have that issue to deal with. I raise it because, in fact, that particular project, which is known as the Green Light Program, actually changed practice in the community. The number of cigarettes has gone down, but more importantly, their homes are smoke-free. So we have 3 communities in Saskatchewan that have 50% of their homes that are smoke-free. When we started with about 20% of their homes being smoke-free, this is a huge step forward. Are we finished yet? No. What we did find, though, was it wasn't tobacco in the homes that were the biggest issue. It was actually mold. And so those combinations actually made a bigger difference. And so we've looked at how we might do this in a different way. Next. So you can see this is about celebrating. I don't know how much of you know about Saskatchewan, but everything here is about green. So the university logos are green. And in this case, they wanted a green light on the outside of their house, and it's a porch light. And so it actually, if you look at it at night, you can see the many homes that are smoke-free by the green light that lights up. It's been very exciting and very successful, and it's out there. And so as a result of that, people see themselves making a change. And we've had a number of people actually become free from tobacco misuse or non-traditional use of tobacco. That does not mean that we're asking them to actually stop using it for ceremony. That was never our intent. Our intent was to improve the health and wellness in the community in ways that were meaningful to them. And so it's been a very exciting opportunity to look at what that looks like over time. Next. I wanted to tell you a little bit about a project that we just recently submitted to the College of Medicine here for what's called a Comrade Award. Why? Because this is something that I've been hoping to do for probably 15 years. It's been very difficult to move it forward, not because of the community, but because of the systems in which we work. So about a month ago, an Indigenous elder, a Métis mother and grandmother, an educator with a PhD in participatory social justice, and my colleagues from the Center for Forensic Behavioral Science and Justice Studies came together to speak with the community about what would work. We often think we know, but they had a whole different idea. And so as a result of that, we are in the process of moving this forward. Next. We're going to hire people in the community with incarceration experience to be peer researchers and collaborators. Our goal is to actually help them to see success. And in doing so, we'll be role modeling the behaviors for someone else. We really hope that this break in the cycle from prison to the community and back to prison actually changes because of the community. I know it changed in British Columbia with the women, and there's a program that's ongoing still today where the women are actually supporting their colleagues as they leave prison. So what can we do? We need to actually be thinking about how we can do this together. Next. So you say, well, you've talked a lot about all of the difficulties. I want you to know what the advantages are. For the community, the advantages are the power to determine their research priorities, the allocation of resources and outcomes. And what does that mean? That means that we create jobs and engage in economic development. Probably 70 to 75% of every grant that I'm involved with goes to the community. Why? Because that's where the work is being done. And it's really important that we actually support that work in the community, with the community. It actually then allows for control of community-related data by the community, increased capacity and skills. We've had some of our members actually go off to university and complete their degrees, and the sustainability of research outcomes. We're not in the program, or we're not in the community, so the program can only go forward if the community is involved. Next. So what's the advantage for researchers? The community data is incredibly robust. Well, in the recent years, we've had 100% of the homes at Sturgeon Lake involved in the work. That's incredible. Do you have that? And the transformative learning experience has changed practice, it's changed research, and it's changed attitudes and behaviors at the local level. If we incorporate local knowledge, it changes how we see things as well. And the accuracy of interpretation as part of the people's work and not just the researchers' work. How often do you see in articles that the people have never seen the data, and yet we're making some interpretations that may or may not be the appropriate ones? And it's our responsibility as researchers to engage and provide opportunities for outcomes to be shared by all, i.e., taking your research community members with you to places like NAPGREG. Next. So in conclusion, I just want to remind you that, in fact, the integration of principles and values of co-creation, participatory research builds capacity, and it changes practice for all. Sustained engagement demonstrates respect, and engagement with individual patients' communities results in outcomes that are both clinically relevant and meaningful. Next. What we leave behind is not what we did or did not do. It is what we said or did not say. Respect the power of words. Choose them with care, because in the end, it is what we leave behind with the people and the communities with whom we engage and work. In the words you choose are the values which you espouse and translate into action. I think we have some time for questions now, so I'm hoping to have that opportunity to meet you.
Thank you so much, Viv, for sharing all of that knowledge and insight, and seeing a lot of clapping hands coming up in the reactions. I'm sure that everybody must be feeling motivated and challenged, and that there will be a lot of questions out there. So for those who have been listening, if you haven't had a chance to do so yet, please enter your questions in the Q&A or the chat panel, and we will moderate them. And as I said, if you do prefer to ask your question out loud, please raise your hand and we'll unmute you and call on you. But sometimes people need a minute or two to think, so we'll just pause for a moment while people think of their questions. So there is one question I'm seeing here. It's coming from Michelle. She says, Viv, you said with, not on. What happens if there's an important question, but it's challenging to engage with a community? For example, they can't travel or meet in person during a pandemic.
Well, interesting question, and thank you for it. We just met via Zoom. We did all kinds of things on Zoom that we couldn't otherwise. I actually purchased a copy of the Zoom that was going to be data appropriate to make sure that the community felt safe and secure in actually looking at how they might do that. I can't do this work without the community, Michelle. So I guess I'm encouraging us to find ways that would be meaningful for them. Telephone's hard. We couldn't travel, and we didn't travel until last summer when we met, but we still met via Zoom during that entire time.
Thank you. And another question, this one comes from Margaret, asking how widespread is the concept of co-creation and research? And is this this co-creation, commitment to co-creation, is it an impediment to initiating research?
Well, from my perspective, absolutely not. But I think you have to build relationships. So if you don't have a community, you need a link to the community by someone who actually is in relationship with that community. I encourage you not to just go into the community, because in the end, they will tell you what you want to hear, but the bottom lines are, it's difficult to know what the truth is. And so I'm encouraging you to think about building a relationship for 12 to 18 months before you think about asking a research question. And yes, I know it's a challenge, I get it. But in the end, you come to the table together rather than in fact separate and apart. It's like going out to dinner You don't normally go to the table by yourself. It doesn't mean sometimes you don't, but I just mean it's really an exciting opportunity to have those discussions so that you build it together, because in the end, it makes a bigger difference.
Do you find that communities are often, I guess, surprised or perplexed at being asked to be involved in the research? Is there a process of sort of, I guess it's related to the building trust, but also convincing people that in fact, like, we really do want to co-create with you, and we really do have good reasons for wanting to do that? Are people skeptical or perplexed, or like, why are you asking me? You're the expert. Do you get that kind of response?
No, actually, I don't. I get the response of, wow, I'm keen. Most often, though, the communities phone me and say, I've got a research question. Can you help us figure out how to answer it? So I'm not actually doing that. I'm actually being connected in a variety of ways, but usually by telephone and usually as a question. And can we actually then work on it together? So it's a different dynamic than if you're actually just going into a community that you've never worked with before.
Thanks. And I guess a related question that's showing up here is, if you, this is from Shasta, if you don't have any connections to the community, what is the best approach to establishing a community, connection with the community in order to have conversations?
Usually the community has other connections, and so it would be important that you connect with the other connections if you're interested in doing that kind of work. I just encourage you not to just go in and knock on the door and say, I'd really like to do research. I'm actually encouraging you to think about how you might engage them in terms of questions about, are you interested, those kinds of things, and leave it with them, because they know what they need, not being told what they need to learn from us specifically. So I get it, but it's not the easiest way. So find a way in with a partner of some kind. I know I take my grad students with me, and then relationships evolve over time rather than, in fact, on a one-shot deal.
Thank you. And somebody else has, Brenda has mentioned in the chat that she says she has found that how you dress can also impact being vulnerable and bringing relational equity to the conversation.
It's interesting, Brenda, because you're absolutely right. And that's why we actually have a conversation with the community around what the code of dress might be. And so the goal is not to turn people off, but to engage them. So if it's jeans, let's go for it. If it's something else, let's do that as well. I mean, everything's appropriate. It's not that it's not, but it's really important that the people in the community actually define what that could look like. What you don't want to be is wearing a suit in inner city underserved communities, because everybody knows that you're the whatever, and it's like not going to be a conversation that's going to be helpful for anybody. So I guess I'm encouraging us to be thinking about all of those things and making sure that people are safe. I mean, we bought telephone minutes for community members, and they go as teams so that they actually are safe, because that's our role, to make sure that things are okay for them when they're actually collecting their data.
Thank you. So, Lydia is asking, Viv, what are some foundational papers or sources for your learning about co-creation research? Would you be able to share some of those with us?
Well, the ones on the slides, if you have a look at those are pretty helpful. Anne Macaulay has been my mentor. She is a physician in Montreal who's worked with Ganamagi for a number of years, and she's written some really interesting papers around that work of participatory research. There's also some book chapters that you can see there that would be helpful for you to read if that's something you're interested in. I actually learned participatory research in India many years ago. And so if you read Paulo Freire, and Pedagogy of the Oppressed, that will also help you. And so my work over the years is very much focused on driving by the community.
Thank you. And we will be sending out an email to everybody who registered or attended today with the links to the recording and the slide deck. And in there, we'll pull some of those resources that you've annotated in the slide deck. We'll pull some of them and mention them in that follow-up email as well. Thank you.
Sure.
So we've seen a couple of others. One from an anonymous attendee asks, they say, I work in the area of research ethics reviewing applications. From this perspective, what more can we do to ensure that true partnerships are in place? So from the perspective of the ethics researcher or reviewer.
Well, it's the same story. You need to actually see an actual relationship. And one of the things that is either true or not true is from the letters that are attached to those ethics applications. Having reviewed a number of ethical applications over the years, you can see where it was a pinned letter by the researcher and signed by the community, but it's not necessarily what the community wants. And so it's important that you actually see some elements of the language of the community being in those particular letters that are attached to the applications. The other thing is you want somewhere in there to be able to identify who actually developed the questions. Did they know about it before the grant application went in or after? So one of the articles that I put on there is very much addressing some of those issues around whether or not people are authentically engaged. And so I don't know the right answers because every application is slightly different, but certainly on the other hand, you're looking for words about authentic engagement, relationships. I've worked with this group over time. And then the letter itself is very much about what they anticipate doing. The other thing that you'll notice on the application is the number of people that are on the list of applicants, like co-investigators, those kinds of things. If they're from the community, then they've probably seen it. My experience is I send the actual application to the community first before I ever send it to ethics. So they've looked at it, they've vetted it, they've changed it and modified it to meet the needs of their community members before I send it to ethics. And then I say at ethics, the community has reviewed this, and this is where they're hoping to move forward to. And then it's usually we're negotiating fine points. We're not negotiating large concepts. I don't know if that helps or not, whoever that is. Is that Brenda?
That was, yeah, I'm not sure. It's an anonymous.
Okay.
So we do also have a hand up, or we had a hand up. Marina, I'm sorry we didn't get to you a bit quicker, but did you still want to ask a question? I can unmute you.
Hi, this is Marina. Are you able to hear me?
Yes.
Perfect. I was the one who posed the question about research ethics. I'm a reviewer of applications and just wondering how we can do a better job. Because it is hard when you see those letters and you're trying to figure out, is this really a true partnership or has due diligence been done? And so thank you. I really appreciated hearing your answer.
Yeah. No problem. Sounds great. Thank you.
Thanks, Marina. There's another question here from Ashna. Ashna says, thank you for this presentation. Have you and/or your research team developed strategies on how we can remain mindful of our power and privilege as researchers and other identities when engaging in community-based research and building relationships?
Can you read it to me again, Catherine? Because it's really quite packed.
It is, yeah. So Ashna asks if you and the research team have developed strategies to help you remain mindful of power and privilege in your roles as researchers and your other roles when you're engaging in community-based research and building relationships.
I guess I'm going to say I leave the power at the door. I'm a nurse. I actually engage in wellness promotion in the community. So in fact, I actually take off my researcher hat frequently and become a wellness promotion specialist. And so engaging in the community at that level changes how they see engagement. That's why the Greenlight program was super successful, because it's not about, again, on, but in fact, it evolved from the community. We applied it in a way that was meaningful in the community and then evaluated it with the community. And so I don't know. Yes, I have power and privilege. And yes, I look at what clothes I wear to the community, like my dress code. On the other hand, we just share a meal. We sit down and we actually laugh and we talk about it. And the community members have come with me to England and to the US a number of times to actually present their own data. So it's not about power for me, although I am privileged. I understand the importance of being and walking beside.
Thank you. And we have a question from Michelle here. Michelle asks if we should plan for broader engagement. And I think, Michelle, I may be unmuting you to unpack some of these questions here. She says, are there communities left behind that should be approached? Is there a risk of loss of engagement that we should think about? For example, in Toronto, the number of people registering for the municipal election is half of that of the previous election. So I think just, saying that there does seem to be a broader disengagement happening, and how do we expand our engagement reach? And Michelle, maybe if you wanted to unpack that a little further, I can unmute you.
Yes, can you hear me?
Yes.
Yes. Okay. So thank you. I'm not sure I put it very well, Viv, but I was thinking, is there a way to think systematically about engagement? Which communities are we engaging with? Which communities are we not engaging with? How to more systematically engage with an equity lens so that we don't just, it's easier for me to go and discuss things with people that look like me or are like me that I connect with, right? So is there a way to think about this more systematically? And also, I know we're getting, with this municipal election was perhaps one of the signals of what's called the Great Resignation. Is this something that we should think about, be mindful about, and also plan to address in the next little while? Is there a risk of lack of engagement in the next little while?
I think there is.
So how do we think about it more broadly, in other words?
Yeah, and I think there is a potential for lack of engagement by all of us. And I say that too because, in fact, COVID created a huge gap in the middle. And so relationships that were okay became almost non-existent if you didn't actually support them over time. So I'm just going to use this as an example, Michelle, because I have no concept of working in downtown Toronto other than the high rises that are pretty close to St. Mike's, because I actually did some work with the East Indian community there. That being said, there's a large homeless population that are never invited to participate. But you can't just go down there and ask questions. You have to go down there and sit around and have coffee and share coffee and do those kinds of things. And it's not necessarily you. It might be someone that you have working with you that looks similar to that particular group of people. I don't know the answers. I mean, I'm kind of mystified sometimes because the communities call me here. And that's a different dynamic than when you're dealing with large populations. That being said, when I'm in South India and we're working on 49 villages that all have, 2,000 or 3,000 people in them, we're talking a large population, but it's still about being in those communities and actually meeting with the elder or their leadership or their community leader, whatever that happens to be, because really there's someone who's actually providing some leadership to those communities, whatever that or whoever they are. And that's the individual that you need to actually get kind of like a face-to-face with, because it changes how they see themselves. Like we've implemented a community outreach program in these 49 villages, with the community leaders being the ones who would hire their own participants. And as a result of that, it's changing their view of research, but it's also changing healthcare providers' ability to actually care for them. So I wish I had all the answers. I don't. I'm sorry. But I think that it's important for us to find ways that are meaningful to that group of people, whoever that happens to be. Does that help at all?
Thank you, Viv. And I'm seeing that the time is 12:56. There does seem to have been a pause in the questions. So this might be a good time to break. I know, Michelle, you wanted to say a few words about the next webinar in this series.
Yes, thank you, Catherine. The first thing that I would like to do is say thank you to you, Viv, for this webinar. It was really insightful, interesting, and on a very important topic. You've really provided some excellent examples of research done in partnership. So with, not on, in partnership with Indigenous communities, and some important guidance also about considerations. What should we think about in terms of doing this work? We're going to have a later webinar in the series that will dive more deeply into this topic. This webinar was originally scheduled for September. However, we discussed this with our Indigenous partner at the Indigenous Primary Health Care Council. And based on their advice and their leadership, we have postponed that webinar. It will be redeveloped in a better way with Indigenous leadership. And I think that is really key, and that is something that you've articulated so well as part of this webinar. We will let you know, we will let everybody know as soon as it is rescheduled. I would really like to emphasize that we are very grateful to the Indigenous Primary Healthcare Council for providing guidance, correction for us where needed. And we're also really grateful to you, Dr. Ramsden, for sharing some inspiring stories with us and some considerations that remind us how valuable Indigenous community partnership and leadership is. Thank you for this.
It was my pleasure. Thank you.
Thank you, Michelle. And I just want to echo Michelle's thanks to Dr. Ramsden for taking the time to share your insights and your experiences with us today. I want to thank the POPLAR Organizing Committee who made this webinar happen, and especially my colleague Marissa, who is here providing some backup support for me with the Q&A. I would like to thank especially everybody who came out today to listen and learn, and I hope that what you've learned today will be helpful for you in engaging more equitably in your own research work. We have recorded this webinar, and we will be sharing the recording along with the slide deck to everybody who registered or came to this webinar today. So please do watch your inboxes for an email, which will come in the next few days. That will include links to these resources, along with some of the other resources that Dr. Ramsden included in her slide decks. And we will also include links to the POPLAR Network and SIPSN, so for those who are interested in joining or getting involved, and to some other equity trainings that are out there. So thanks everybody for joining us today, and I wish you all a wonderful day and a wonderful weekend. Thank you so much.
Thank you.
Thanks, everyone.